Hi, I'm Dr. Stuart Cox.
And I'm Dr. Jared Norman, and we're with Nevada Spine and Disc. We'd like to give you a chiropractic tip. If you're currently looking for a chiropractor, there are three main things that you should look for. One is experience. You don't want somebody that just graduated out of chiropractic school to be working on your body. It takes a couple of years to really get the hang of things and to know exactly what to do with the patients. Number two is, are the chiropractors keeping up to date with the latest in technology? There are so many ways to treat the human body, and some of those ways are through physical therapy. You really want a chiropractor who's using the physical therapy modalities in their office. Electronic muscle stimulation, ultrasound, they could be doing laser, and a massage therapy. These are the types of treatments you want your chiropractor to be utilizing in their office. And number three is, do they take x-rays in their office? You don't want the chiropractor that you go to be guessing about what's going on with your body. You want them to take the x-ray and be able to find out exactly what's going on. What are the underlying conditions inside your body that are causing your problem? A question I get asked all the time is, what is a good exercise for my low back? Now, after you've suffered a low back injury, I don't recommend doing exercises where you actually bend your back very much. Now, it's important to try to find exercises where your back is able to be kept almost straight. And the best exercise that I've found for that is called the plank exercise. Now, this isn't solely for the low back, it's also for the abdominals and the whole entire core muscle area, okay? So I'm just going to go ahead and show you how to do this exercise. You're going to come down, you're going to be on your elbows and your toes. So you're going to get your elbows in line with your shoulders. You start on your knees like this to make it easy to come up, and then you're just going to lift up your hips and hold it on your toes. Now, when you're in this position, you want to keep your head nice and straight, looking right down towards your hands. Don't look up and don't look down, because that'll cause a lot of stress on your neck. Okay? Another part of the exercise is, you don't want to lift up your butt like this, and you don't want to dip like this, because that'll hurt your low back. So once again, you start up on your knees like this, and you come up on your toes, keep your body straight and your head straight ahead. All right? And that's how you do the plank exercise and strengthen your core muscles to really just stabilize your low back and keep you from having this injury come back again in the future. With this exercise, you want to be able to hold it as long as you can. Work up to where you're able to hold it for at least a minute, and that's when you know that your core muscles are much stronger.
If you're experiencing symptoms of neck pain with radiating pain down into the arms or hands, numbness and tingling as well, if you're having those types of symptoms in your lower back where you are experiencing pain into the buttock area, leg, foot, these symptoms relate to a condition that has to do with the herniation or possibly bulging discs. I've had patients ask me, are there any alternatives to surgery for having this problem resolved? And the answer to that is yes, there are. The table that I'm sitting on is a spine med table, which is a non-surgical spinal decompression, which takes the disc, the herniated disc or bulging disc, and retracts that material, taking it off of the nerve and back into the disc. If you're interested in a resolution for your problem with disc herniations, disc bulges that are causing this type of pain, numbness, and tingling, I would recommend that you find someone who has the spine med table, as it is the most advanced technology that's out there today. If you've liked what you've heard and you'd like to know more, visit us at stopthebackpainnow.com.